Today we're going to prepare teeth numbers 9, 10, and 11 for veneers. Now that's an odd assortment for veneers. Normally veneers are done in singles or pairs, maybe 2 central incisors, maybe all of the incisors, maybe canine to canine, maybe first premolar to first premolar, or second premolar, even molar to molar. So those are the more common combinations of veneers. The reason we've chosen these 3 teeth is they're anterior teeth, and you'll learn something different from each one of the 3 by doing them this way, rather than picking 1 or 2 or 3 or 4 right in the center of the mouth. So we're going to be focusing on 9, 10, and 11 today. Now the first thing you'll want to do with veneers especially is make yourself a reduction guide. These are going to be light preparation veneers. Veneers can be no preparation. Those can be very challenging, and they can sometimes cause other problems because they add contour to the tooth. That's a subject for another day. Or veneers can be a heavy preparation veneer, and if we were doing lower anterior teeth, they would be a relatively heavy preparation. They're much like a reverse 3/4 crown that would be prepared for those teeth. This is the most common type preparation for veneer. We're going to be reducing 0.3 to 0.7 of a millimeter. So 3/10 to 7/10 of a millimeter in reduction. The reduction guide in this case can simply be made from the typodont teeth. They're the shape we want to end up with. If you were doing this clinically, you might be able to use the teeth that you're preparing if you're keeping the morphology the same. If you're not, if you're changing morphology, if you're lengthening incisal edge or doing something else, then this reduction guide would probably be made off of a diagnostic wax-up on models. So because we're using the teeth as the guide, I'll go ahead and start that. You want to thoroughly mix these putty materials until there's no streaking. Latex gloves can hinder the set. They can interfere with the set. There are sulfides in latex gloves that they mess up the setting of these PVS putties. These are non-latex gloves, so we shouldn't have a problem with that. But just be aware of that. Your matrix needs to go at least 2 teeth beyond the ones you're preparing, which means this one needs to start at 7 and go back to at least number 13. And the streaks are about gone now. Just about, a little bit more. And now we'll apply our matrix. Don't have the contours too full facially or it won't fit up underneath the lip. Squeeze it into the embrasures a little bit, like that. And then we'll just allow that to set. We'll do another matrix after this one sets, and that one will be specifically for the temporaries that we'll be making. This is one that we're going to section. We're going to section it into 3 pieces. We're basically going to divide the facial surfaces of these teeth into thirds. And so we'll have 3 different matrices that we can place on our preparations as we're proceeding along to check our reduction. So our putty has set now, so we'll remove it, and we're going to get a sharp 25 blade and a red handle knife. It doesn't have to be in a red handle, but it's helpful. And the first cut we're going to make will be for the gingival third. It doesn't matter so much back in the posterior where you are, but you do need some engagement with unprepared structure, whether it be tooth structure and or soft tissue. So I'm going to start this at about the gingival third of these posterior teeth as well. It gets more critical when we get to the canine. So we're trying to keep this as close to that gingival third as we can. It doesn't have to be exact, but you want to be in the ballpark. And we'll set that one aside. And now we'll do the next third. Okay, so now we have 3 different matrices that we can use. We can set this one on to give us a view near the incisal edge. We have this one for the gingival aspect, and then we have, of course, the slice out of the middle that we can easily add to that one like this to check our reduction amount. So we'll set those aside, and we're going to make one other putty matrix, and this one will be to help us with our temporaries here in a little bit. So let's mix this one just the way we did the one before. These can be done very quickly while you're trimming the matrix. If you're doing this chair side, while you're trimming the matrix, your assistant can be mixing the putty for the next one. If you're making these up in the laboratory ahead of time off of diagnostic wax-ups, that's another story, but clinic chair time is precious. Actually, all of our time is precious, isn't it? We should try to use it wisely. But this can be being mixed by your assistant, and when one matrix comes off, the other one simply goes on, and there's very little lost time. So this is the principles with this one are the same. You want to go at least 2 teeth beyond the ones that are being prepared. And you want to extend up onto the gingival tissues. All of that anatomy gives you an index to work with to help orient your matrix. And then we'll just let that one set up as well. The burr that we're going to be using for this is the Brasseler 6878K018 diamond. It's a chamfer diamond. It's the one that we use for most of our crown preparations. It's a great diamond. It's a little bit small for interproximal areas next to an unprepared tooth, and so I'm on purpose, we're not preparing tooth number 8 so that you can see how you would handle a veneer next to a tooth that is not being prepared. The idea with veneers is you need to break the proximal contacts in order to get a good impression. Now, there are exceptions to that. You don't have to break the proximal contacts in every case, but if you don't, be mindful that the margins will be difficult to read and you may tear your impression. If, on the other hand, the proximal contacts are slightly broken so that they're discernible and the laboratory technician can read that margin all the way along, it's usually easier to make a better fitting veneer. So sometimes taking a little more tooth structure away can help you get a better fitting veneer, as opposed to stopping short of the contacts or ending, even worse yet, ending the margin interproximally right at the contact. Those are very, very difficult to deal with, so try not to do that. The rule of thumb is any mesial facing contact, interproximal contact between 2 teeth on first molars and anterior teeth should be broken. If it's a distal facing contact, it's not as critical, and so that's another reason we're stopping at tooth number 11. The distal of 11 is a distal facing contact, and if it's handled well, can be done without breaking the contact. We won't even get to the contact. We're going to stop short of the contact a little bit so that that margin is discernible. The other reason for not breaking that contact is it's often a very broad contact, and if you break it, you're going to be going all the way around that tooth, clear to the lingual aspect, and now you're taking a lot more tooth structure away, and there are other issues that come into play there. But in terms of breaking proximal contacts, as a general rule, we break them when we can, unless they're ones that are not going to be visible from the front of the mouth, and we can hide them appropriately. So distal facing contacts, veneers in the posterior of the mouth, in general, unless it's the mesial of a first premolar, are not broken. The mesial of a first premolar, that contact has to be broken because it's a very visible contact. Okay, so I think this is probably finished now. We'll take this off. We're going to set it aside. And, while we're at it, well, we'll come back to this. This is something that I want to focus on a little bit when we make the temporary. So let's go ahead and start our preparation. We've got our burr in place here. And the idea here is to use those reduction guides frequently. The first veneer preparation we'll do is an incisal butt margin. So we're basically going to divide the incisal edge in two. We're going to prepare facially, but we're going to maintain the incisal edge position all the way along. And then we'll turn these veneers into a lingual chamfered preparation. There are two different preparations. They're a little bit different. But we'll start with the more conservative, facial only, incisal butt margin veneer. So facial only. You create a light chamfer at the gingival aspect. We want to stay 0.5 supragingival. Now that has no clinical significance at all, does it? Because typically, clinically, these margins are at or slightly subgingival. But on a typodont, we're going to keep them up above the gum line. I'm going to start by just preparing tooth number 9. Now, one of the things you do with veneers is you tuck the gingival aspect of your proximal area, that interproximal area, you tuck it toward the palatal. So this veneer kind of wraps around the facial aspect of the tooth. So we're going to start tucking this one in too. Now, if I was just doing a single veneer and I wasn't preparing any of the adjacent teeth, I would need to drop to a smaller size at this point, but we're going to check our clearance here first. So we'll start with the gingival aspect and just place this on. I can tell I'm way under reduced right at the facial aspect. And so we'll continue on with the preparation with this diamond before we change to the smaller diamond. So again, our target is 0.3 to 0.7 on this. And we're getting closer now. That's kind of in the ballpark. On the gingival aspect, if we were to add the second matrix, We're in the ballpark there. So we're pretty darn close to that zone. I'm going to place both these aside. This part of the reduction guide doesn't help much until we get into the veneer that wraps around over the incisal edges to the lingual aspect. So at this point, I'm going to take this larger diamond and drop down to the 6878K012. So same basic shape, it's just smaller in diameter, and it allows me to be a little bit more conservative up next to those adjacent teeth that at this stage of the preparation we're not preparing. We're going to not prepare 8, and eventually we're going to prepare 10, but I want to show you how you do a single veneer here. So now with this smaller diamond, we want to just break the contact. So this is also really, really important right here. Up near the gingival aspect, in the gingival embrasure where I'm preparing right now, I'm tucking that veneer into the palatal aspect. I'm preparing way into that embrasure. If you don't, your veneer is just like a postage stamp out on the front of the tooth, and it looks fine from the straight facial, but if anybody looks from the side a little bit, you can see, especially as time goes on, if they start to stain it all around the edges or anything like that. So you can see how far we're tucking this. It actually ends up going about halfway to the palatal aspect of the tooth. So you lean that diamond quite a bit so that you can create that light chamfer way up interproximally there, like that. And then we're going to work on the contact area. So I want to prepare just to the point of breaking contact. You can get undercuts with veneers, so you got to be careful with that. And I've just broken contact, just barely there. It's important that you don't leave this fin of unsupported enamel that has a J-lip in it. You want that enamel exit angle interproximally to be close to 90 degrees. So there will be a fin of enamel that comes out, but it shouldn't have a lip in it. So we've achieved that at the mesial. We've broken contact slightly. At the distal, we'd simply treat it the same way. We want to tuck in, tuck that gingival aspect way into that embrasure, like that. And then we just get to the point of breaking contact here. And this diamond is starting to get a little bit dull, so I'm going to have to change it out. Especially at the tip, which these small diamonds do very quickly. Now it's got a little lip on it that we need to get rid of. So we use the tip of that diamond. It's not cutting very well anyway. And just get rid of that fin, and we've opened the contact up. So the contact is open. We just need to make sure there's no sharp areas now. And that is a facial only preparation for a single veneer. That's how you'd prepare it. just enough to break those contacts slightly so you can get a nice impression. We've checked with our reduction guides. We have a uniform amount reduced all the way across the facial aspect. And so now we're going to move on to 10 and 11. But before I do, I am going to change diamonds. I'm going to get a different 012 diamond, so we'll do that quickly. So I've gone back to the larger diamond, the 6878K018, and we're going to proceed now and prepare number 10 and number 11. And it's kind of nice when you're doing a lot of veneers because you don't have to drop down to that smaller diamond when you get to that interproximal area. You can just stay with the large diamond. You start preparing from one tooth, you go to the next, and it goes rather quickly. So we'll have our patient turn a little more to the right, and we'll move on here now. I think I will refine while I've got my larger diamond in. I'm going to refine that facial margin just a little bit on the one we started on 9. Now we'll move on to 10. Again, really important to tuck that gingival aspect palatally. And it's nice here because see, I can start right into number 11 while I'm doing this, just to the point of breaking contact, tucking that gingival aspect palatally so that that doesn't ever become an eyesore if the margin were to stain on you, which they can do over time on these. So I'm tipping that diamond so I can get that palatal aspect way over to the palatal. And now I'll just continue to prepare interproximally here, and I've got a broken contact already. I just need to make sure that number 10 is also broken. I'll break the contact between 10 and 11. I've just got that diamond right between the two teeth, just like that. And we're just going to go till the contact breaks. And the contact's broken. Sometimes you end up being just a little over-prepared interproximally because of this. The way you're breaking the contact, and that's okay. There's not a problem. We're going to continue on to, again, like I say, 11. I'm going to have our patient turn a little bit more to the right. Now on the distal of this canine, I don't want to break the contact, so I need to stop short of that contact. And it's just about time to get out our reduction guides to see how we're doing. So we'll set our gingival aspect in place, like that. And straight facially on number 10, I'm under reduced. And I've got some under reduction areas on number 11 as well. So at least in the gingival aspect, I need to reduce more. And same with, although not quite as bad incisally, but I am under reduced there. So let's put our reduction guides aside. And we had to reduce a fair amount more right here on the straight facial, so let's get that done. These incisor teeth, especially on these typodont teeth, they're pretty flat. The facial profile is, and so don't over curve them during your preparation. Again, preclinically, we're just trying to keep those margins a little bit supragingival. And we're aiming for 0.3 to 0.7 overall reduction. So about 0.5 millimeter is the sweet spot. This can be a little tricky on the distal of the canine. I'm trying to not get to the contact. I don't want to prepare up to that contact. I'm stopping short of it. At the same time, I'm trying to keep my gingival aspect as far into that embrasure as I can get it. If we get lazy and just prepare to the contact and don't focus on those gingival areas, we don't wrap around the tooth near far enough. So you've got to treat the contact area differently than you do the gingival embrasure area on these veneer preparations. So you really need to tip that burr and tuck up into that embrasure like that. So let's check with our reduction guides again. There we go. And we're really, really close. We might be just a little under-reduced toward the distal of the canine. I think I'll work on that one right now and then come back with that second layer. So right in here, we were a little under-reduced. And that's how you use these reduction guides, just frequently check and now I'm a little under-reduced toward the mesial. Remember, this canine is anything but flat in its facial profile. So you need to maintain that curve around the facial. There we go. Okay, that's looking better, and then we'll add that second layer, slightly under-reduced toward the incisal on the canine. So at the incisal edge, we're simply just splitting that incisal edge, facial prepared lingual knot. I'm going to dress this one up a little bit. And then making sure that everything is rounded internally. This is a little sharp right here. We've got broken contacts everywhere. Stop short on the distal of the canine. Wouldn't hurt to open this one up just a little bit more. And that is it for facial only incisal butt margin veneers. These are the most conservative, aside from a no preparation veneer that you can do. They're the most commonly done veneers. In addition to the variation on this that I'm going to show you next, and that is wrapping that veneer over the incisal edge and having the margin, rather than being up on that incisal edge, having it on the lingual aspect of the teeth. And so we'll do that next. That's also a very common veneer style. It's a little more aggressive, but it gives you more opportunity to change shape as well. So the incisal edge of your teeth that you're veneering has to be in excellent shape to use this veneer design. If you have worn into the dentin on the incisal edge of the tooth, don't do a facial only. You need to protect that incisal edge. If you're into the dentin, the tooth is going to continue to wear there, and the veneer will chip, the tooth will chip, and it will not last. So when that's the case, you need to put the margin on the lingual aspect, and so we'll do that next. The first thing is we need 2 millimeters of incisal reduction to wrap over the edge. And so we'll do that next. And we'll start with just some guide cuts. We want to get close to 2, maybe 1.75. We'll do the same thing with the lateral incisor and then the canine. So there's some guide cuts to get us in the ballpark. They're a little shy of 2, but they're close, and so we'll now connect them and just cut that incisal edge off. You want to try to avoid having the margin of the veneer on the occlusal contact area. So you have to check the occlusion and see how the teeth are coming together, and need to make sure that that margin doesn't end up right on the contact. So you need to adjust it. You can't adjust it too short, because if you're much less than 2 millimeters of incisal reduction, your veneer will be weak in that area. So if it ends up being right on the contact area, you're going to need to take your chamfer down the lingual aspect of the veneer, or excuse me, of the tooth just a little bit more. So check that. We'll continue to connect these guide cuts. We'll come to this mesial of 9 here in a minute. This is where this matrix begins to help. You can't see it from above, but you might see it in the mirror. And it starts to give me an idea of if I am reduced enough. And the one thing that you don't want to do is under-reduce near the incisal edge on these. So, in other words, if you're going to wrap the veneer to the lingual, the facial reduction will actually increase a little bit as you approach the incisal edge, so that that porcelain doesn't get real thin at the bend as it's going over the incisal edge. So I'm going to actually take a little bit more off facially right in this area, and then transition those over the incisal edge like that. And we'll shorten a little bit more. We're still just a little bit short of, let's see, we got 2 millimeters with this. And I can tell that we're still just a little bit short on our incisal reduction. So we'll take that down more. Okay, that's getting very close to where we want to be. And let's dress up our canine here a little bit more. That one, again, we have to keep the margin short of the contact. So we'll actually have a margin near that proximal contact that will be away from the contact area itself. And it has to be that way. You don't want to leave that enamel too thin and unsupported there. You can often use the tip of this diamond to just cut that off. But again, staying clear of the proximal contact as you do that. Same is true with this area right up here, near the mesial, right near the midline. If you've broken that contact, you should be able to take off that little ledge there. So our incisal reduction, I've got a little bit more to do right here toward the mesial, I can tell. So I'm going to stop at this point, and if we were doing a lingual butt margin on our veneers, we would simply round everything off right now and we would be done. We're going to turn these into a lingual chamfered margin, and it's a very light chamfer, and the only reason for doing it is it helps the veneer to seat. If it's a butt margin on the lingual, as that veneer is coming into place, it's possible that the incisal edge won't go palatally as far as it should go if it's just a butt margin on the palatal aspect. By putting a small chamfer on that palate, it guides the veneer into place. It actually only seats one way, and so it's a little more secure way to make your margins when you're doing the incisal edge wrap over design. So again, you could do a butt margin there. Just make sure that your veneers fully seat when you insert them. We'd round everything right now and be done. But because we're going to do a chamfer on the lingual, I'm going to add that next, then connect all of the margins and then round everything, and then we'll be finished. So let's add the lingual chamfer, and it is just ever so slight. It's with the tip of this diamond, and I'm simply just adding a little bit of a dimple on that lingual aspect. And so I will add that now. I'll start on this lateral. And then go to the central. And then we'll do the canine. Let's check and see where our occlusion is on this, because it could affect where that margin ends up, as I mentioned before. And the occlusion is going to be just barely, but it is going to be on the ceramic, and that's good. We're okay with that. It's better if it's on enamel, but the anterior coupling on this typodont patient is such that there isn't a lot of overlap, and in order to get past that 2 millimeter minimum, we're already up where it's going to be a contact on the porcelain, and that's okay. Just try to avoid having it right on the margin of the two materials. Let's see back here. Yep, that'll work nicely. So let's just turn this canine into a light chamfer here. Now what I'm going to do is connect the vertical chamfer with the chamfer on the lingual. So I'm going to take that interproximal area and just round it onto the little chamfer that we've added to the lingual, just so that's a round, smooth round transition there. And then this is the one that's the toughest to do because you're right next to that unprepared tooth, but just round it. And so now we've rounded all of our transitions from our vertical chamfer that's created interproximally to the chamfer that we have on the lingual. And now we're just going to round all of our internal line angles. That's really important that there's no sharp spots left anywhere. So we're going to do that last. And again, whenever you're rounding, you want to look from multiple directions so that you don't leave any sharp spots. And we'll check with our reduction guide and see if we're done yet. So I'll start with this incisal segment. Let's see, like that. And I can tell by looking right up into this area right here that it's kind of thin right at that incisal edge. And that's what this segment really helps with, is identifying thin areas and it's a little thin on number 9 also. So I'm going to take the incisal aspect, so the facial of the tooth, but near the incisal edge, and I'm just going to take it back and let it transition a little more smoothly onto that lingual surface. That one was okay, so we're going to work on this one. Nice smooth transition. Or you're asking for breakage trouble. These veneers are just very delicate until they're bonded, and once they're bonded, if you've paid attention to these principles, they're very, very successful. So let's get our matrix in place again and see if that transitions a little better. Yeah, that's much better. Although on the distal of the canine, I could still go in a little bit, and so I will do just that. The reason that's not wanting to go in quite as much is we're not preparing around that tooth as far, are we? Because we're stopping short of the contact. Now, if I was preparing tooth number 12, we'd just break that contact, wouldn't we? But if we were stopping our veneers at the distal of 11, then we have to stop short of that if we can. you can break that contact, but then what you have is a veneer that's wrapping so far around that canine tooth that it's real easy to get undercuts on the facial. These veneers insert kind of at an angle. They come in from the incisal facial, and because of that, if there's an undercut bulge on the facial of the canine, it won't insert. So if you do wrap all the way around by breaking that distal contact, make sure you don't leave it with an undercut. And it looks to me like we're there. Let's double check with our incisal again. That looks better. And then we'll come back to our gingival. Just see how that looks. Very good. And I will keep that on and just add this middle segment. And it looks good. It's wrapping around the corner. It looks like it's to the point where we can say we're done.